Hey, it's Jessica DeMassa with WTF Health. What's the future health? I'm talking to the who's who of health tech and healthcare innovation. And joining me today, we've got Niru Rajakumar. He's the vice president for Asia-Pac for Orion Health, which is actually like a pretty out there older health information technology company that's based in New Zealand. So Niru, it's great to have you here.
Likewise, Jessica. Thank you for having me.
All right, so Orion Health, you guys have been in health information technology for 30 years. So it's like you guys are older by my book because I usually talk to startups. And like I said, you guys were founded in New Zealand. You're a New Zealand-based company, but you guys operate in 15 different countries. And so who better to, who to have a brain to pick about what's going on in health IT these days when there seems to be so much change, because you can really help provide us with a global perspective. But before we get into that, Nira, I want to just start off and ask you, a little bit about Orion Health. So tell us a little bit about the business. Like, I understand you guys have three big core products. You guys are working on a digital care record, digital front door platform, and then you guys do some healthcare intelligence. So the healthcare analytics side of things too. But take it from there. Tell us a little bit about Orion Health.
Yeah, sure. Thank you, Jessica. So Orion Health, as you say, have been around for 30 years. We are proud to be 100% healthcare focused. So, that's one of our differentiators as we work with a lot of our customers around the world. And we have about 600 staff globally across 15 countries and 5 continents. And yeah, we did start in little old New Zealand and punching well above our weight around the world. So we're very proud of that.
That's awesome. And now you and I met in Australia, which is really exciting too. So we've had an opportunity to chat before, but I do want to pick your brain a little bit about some of the different, trends that you're seeing globally about the different types of technology that you provide. Because I feel like, this healthcare IT space is starting to have like a rebirth. And there's a lot of like the conventional thinking, like, well, I'm stuck with my legacy EMR provider that's being challenged in ways that it hasn't been challenged before. But I want to get your take and I want to hear what you're hearing from some of the clients that you're working with in different parts of the world. So like, let's start off and talk a little bit about the digital care record that, you guys are selling there at Orion Health, but this really goes in the face of like, it's an EMR, right? I mean, it's an electronic health record, updated for this modern age, right? But so tell me what you think is, as far as how things are changing when it comes to the way that different healthcare organizations are treating that important piece of technology. I mean, it really is like not just so much a record. I mean, it's the thing that's really, coordinating care. I mean, it's helping with billing, like it's functioning in a lot of different ways, and doing a lot of tasks that is accumulated over the years. But tell me what you're seeing in the market, or how are different healthcare organizations around the world, treating their EMR these days? Are they looking at it through a new lens?
Yeah, it's a great question. So the digital care record, the beauty of it for us with the technology that's evolved over almost 30 years, right from its inception, is that it can be used in settings where hospitals are using it as an EMR. And obviously, New Zealand is one of those places where we've got our technology digital care record right across the nation in hospitals used as their primary EMR system. But equally, what we do around the world with the digital care record is quite different, which is the concept of the health information exchange, obviously in North America, the UK and the Europe call it shared care records. But what it is aggregating patient data from different care settings and unifying it for the clinicians. So you have that really single health record view of a patient. And we're quite proud of that because it is a technology that obviously has evolved over years, and we've got 60 plus of those around the world. And at the moment, it's only rapidly evolving as other markets catch up around that patient-centered view of the world.
That single patient record is like the holy grail in health IT, right? But why is it so complicated? Like, I mean, we here in the US, and we're obviously plagued with this interoperability conversation. Is that still a thing that people around the world and other places with different types of health systems are talking about? Is there still an interoperability challenge in those markets?
Absolutely. That's what I call table stakes. You need to really make sure the interoperability is at the heart of everything, because what we do have is a lot of data, a lot of information, but unfortunately it's in silos, it's in disparate systems, and it's quite consistent right across countries. Some countries do it obviously better than others, just because of their level of policy setting and regulation and their commitment across the government. However, my observation is that, yeah, it's still table stakes, and we still have to solve that challenge to move forward.
Hopefully we're getting somewhere. What do you think? Are we getting anywhere on this?
I think we are. I think we are. I mean, we're in 2023 now. A lot of people are digitally savvy, which means that the expectation for not only the workforce, as in the clinicians and the healthcare organizations, but also the patients who receive care, expect to digitally engage. I look at other industries out there like banking and retail. They're well advanced in this area, and I don't think healthcare is broken by any means. It's actually just behind, and this is the opportunity to actually address it. So yes, interoperability is a big focus for a lot of the countries. Some are just more advanced than that.
Let's talk about another big focus, and this kind of came out of the pandemic, digital front door. I mean, that is a phrase that I feel like, emerged alongside the pandemic and then became adopted by a lot of healthcare organizations as a strategy almost immediately, like, as the pandemic was waning, to make use of some of the technology they put in place to provide virtual care. Now, the big buzzword for me that I'm hearing, and I'm going to have to test this and see if you're hearing the same thing, is omnichannel care. So, I mean, first of all, Niru, are you hearing a lot about omnichannel care, in the 15 different countries that Orion Health serves? And if you are, talk a little bit about how the digital front door has even changed from the pandemic years to where it is now, and how healthcare businesses are looking at the digital front door as part of that strategy.
Yeah, absolutely. The short answer is yes. I'm noticing that everywhere. You would have seen that since COVID. Traditionally, healthcare wasn't challenged in that space because you had your patient portals, which means that patients can engage with their clinicians in the hospitals and get the information they need. But that's really just scratching the surface. And what COVID did was really flip that on its head. There was no ability, obviously, to engage face to face. So virtual care came in pretty quickly. But it's not just about virtual care and having that online teleconsultation. It's about having the right care at the right place, at the right time. So being able to be in your own home at the comfort of your couch and have a prescription sent electronically, or being able to check your symptoms through an AI digitally enabled tool, or being able to identify where the closest pharmacist is. And so that actually having in a single omni-channel platform for a consumer or a patient to engage with is very powerful, and that's really taken off since COVID. And I'm actually quite proud that we're sort of taking the lead on that and have done pretty cool stuff around the world, especially in Canada and Ontario, which I'll talk a little bit about a bit down the track.
All right. Well, I'm excited to hear about that. I'm curious to hear, you talk about a patient portal, and I roll my eyes because it's like we've got to do better engaging patients digitally than just the patient portal. So tell me a little bit about, I guess, and maybe this is where the Ontario example will fit in, but how some of these different health systems are looking at digital as a way to engage, not just like, I mean, we're not even calling them patients anymore, but healthcare consumers in a way that is so much more meaningful and valuable than just the patient portal, which is kind of just a static exchange of information, and a lot of times a source of frustration. So how are you seeing digital front door deployed well? Like, give us some of those examples.
Yeah, sure. So the perfect example is the Canadian one in Ontario. So one of their big drivers was taking a value-based approach, which means how do we reduce the inappropriate ED visits in Ontario for 15 million people? And when you sort of start asking that question, you got to really take a different lens and approach to engaging the people in that province. And that's exactly what they did. So they went out to market. We won that opportunity, which was fantastic for a Kiwi company. And we work with a number of partners. It's a consortium that comes together to solve that problem for the Ontario government. And so what we ended up establishing was an omni-channel platform that is available for the 15 million people to engage through and actually have some really valuable assets through digital channels, but also being able to engage with a nursing call center that you can do that virtually and then get triage. And then therefore from there, if you need to go see a doctor or a specialist, you can do that. The really fascinating thing about that is to serve a patient or a person that enters the ED or urgent care center, it costs the government about $1,200 roughly from what I've heard. To engage the nursing call center virtually, it costs them about $38.
Wow.
And to use the digital channels and the tools, it brought that down to about $3. So you can see that it pays right back the return on investment.
Yeah.
And what really the next thing about that is, as a consumer or a patient there, when you log into that digital front door, the options are right there for you. So you can engage with an AI-based symptom checker, and this is one of the high qualified ones around the world that was really vetted before we put that in there. And so it doesn't give you an actual diagnosis, but it gives you some recommended guidelines to what you could do next. Another really cool thing is around a health services directory. And so what that is, it identifies who your local pharmacist is or who your local GP is within the proximity of where you live. So you don't have to go try and figure out where you need to actually engage with the healthcare sector.
No, I love
And
that.
then, like I said, yeah. And then for me, the other one is a medical library. So we established a trusted, credible medical library that gives you the A to Z conditions and treatments, diagnosis, pretty much everything you need. And you think about today's world where people go into the rabbit hole of Dr. Google. And so it avoids that and actually gives you some trusted information that you can follow through on.
That's fantastic. I like the self-serve aspect of this, and I also like the fact that it's, it really allows the patient to, make a decision about like what type of care and how much involvement they need from a different level of providers. So kind of matching that acuity to the right kind of person who's delivering the care. I think that that's really a unique approach for a digital front door. I like that. I'm curious to hear about the data analytics side of your business, because this is one of those things that I think is so emerging, especially as everybody is talking about not just AI anymore, but now large language models and generative AI. So, I mean, curious, Niru, tell me a little bit about that side of your business and some of the cool things that are happening at Orion Health when it comes to that healthcare intelligence platform that you have.
Yeah, sure. One of the things that people may not know about Orion Health is integration and interoperability and working with big data has always been our core strength right from the beginning. It's just come in different forms and flavors. But what the really cool thing about Orchestral is it's a full rich data platform that allows you to work with different health data, but also health adjacent data. So what that means is it acquires large sets of data from healthcare, but also from non-healthcare. So if you think about the social determinants of health, that really makes up 80% of a person's health and well-being picture. And so that piece of information is really important to understand the overall healthcare for that person. So what our Orchestral Health Intelligence platform does is it acquires and analyzes that data and then actually provides insights for providers, right from clinicians to data analysts that work with that data. So you can see the patterns and trends. And that was very powerful during COVID because we had to kind of pivot and think about some specific COVID scenarios and modeling. But then now we're out of COVID, we're thinking about much broader than that with all sorts of different use cases that are out there that'll serve not only hospitals, but large healthcare providers, such as even payers out in the US market.
All right, so tell me what's happening with your market. Let's dig into this a little bit. Like I said at the beginning, you're responsible for the Asia Pacific area, but I mean, knowing you've got your finger on the pulse of what's happening broadly in the different countries that Orion Health serves. And so, like, help clue us in, like, what's happening elsewhere. I mean, like, I have a very, I have a U.S. centric kind of focus, and I'm curious to hear of some of the things that we're talking about here, what's resonating, outside of of our country, and in specifically health systems that are organized differently than ours is. So I'm
Uh-huh.
curious on that, from your standpoint, what are you hearing? Like, what are some of the top buzzwords? Like, I'm a big buzzword girl. So it's like, what are some of the top buzzwords that you're hearing? Like, what are these hospital executives in Canada or in, some of these Asian countries that you're working with, or even in New Zealand? Like, what are folks talking about? Like, what's at the topic of, what's at the top of the agenda, the big topic of conversation?
That's really interesting. It depends really on the country. That's my observation.
Oh,
I've just done a
really?
trip around. Yeah, I've just done a trip around Asia, and I see there it's really about joining the health system. So they're sort of at the fundamentals. They've done some really cool stuff with EMRs and hospital systems, but how to actually join up the system. In places like New Zealand and Australia, I'd like to think we're a little bit more advanced, but we're still have to join up that health system fundamentally between primary, secondary, and community. But the real buzz at the moment is, I got to say, it's AI. That's what everyone is talking about. So we've got these vast amount of data everywhere, and what do we do with that data once it's all in one place? And that's where I think having the concept of AI actually play a role is quite important. And you got to be careful, because you got to do it in a safe and secure way that it doesn't actually breach the ethics of healthcare or puts anything in a compromised position. But I think that's where you've got to take it in a phased approach, really, where AI can really play a role in reducing the administrative burden. So that's probably top of the list, for regardless of where you are in the healthcare setting. How does it improve the efficiency of the day-to-day for a clinician so they can spend more time with their patients? So there's that aspect of it. Yeah.
So I was going to say, so take us in
And
the room on that, because I want to dig a little deeper there. So it's like, is that really like the conversation around AI? What I heard you say, and I want to check it. Is that like it's mostly being looked at as a way to improve, like take away some of that admin cost, like improve the administrative aspect of healthcare. Tell us a little bit about what that includes. Is this just like, can we build things faster, like coding? Is this what are some of the specific, I mean, you're the guy at the table talking to them about what the technology can do. So what are the questions that you're being asked in that kind of conversation about improving, healthcare administration, some of those tasks? And then the second part of what you said, which was improving the clinician's experience. So like, how is AI being talked about even in those conversations? I want to get a level deeper.
yeah, sure. So I guess it's when it comes to, if you think about the clinician's day, other than spending time with their patient, there's a lot of follow-up. You're writing notes, you're writing discharge summaries, you're effectively writing clinical documentation. Could we actually get AI to support in that? And the answer is yes, if you apply it in the right way. Now, I'm not the AI technology expert, but what I can tell you is that that's the conversation that's been had at the table. So the concept of the other day, I saw a digital assistant came about, where a lot of primary care, what they're engaging at the moment is, how do we actually spend the right amount of time with the patient rather than writing up the actual paperwork? And so the digital assistant, what it does is it actually compiles a lot of that paperwork and actually summarizes it for the clinician or the GP in this case, and actually puts it back into the health record. So that's quite powerful, but I think that's a simple use case. The other end of that spectrum could be along the lines of more clinical decision making. So Orion Health recently just partnered with a company out of the US in Dallas called Pieces. What they do is AI-generated patient summaries, and they work with a lot of EMRs around the world. But equally for us is with our digital care record and health intelligence platform around the world, we can effectively offer that to our customers as well as our prospects in future, to be able to provide that patient summarized view. And I think what the really cool thing about that is, that's just scratching the surface at the moment. That's one use case. I'm sure there's going to be multiple along the way that we can actually enable.
All right, last question for you. I mean, as far as what's next for like healthcare technology, I mean, what do you have your eye on? I mean, is it AI? Is it generative AI? I mean, like I feel like at one point everybody wants to jump on this bandwagon, but have we really seen any real life examples at scale yet that we can do that, or is this just another technology that's hyped up like blockchain was, like half a dozen years ago? I mean, it's something that like everybody wants to hang on to, and there's definitely, the mind reels with ways that it can be implemented, but then, the practical considerations of, privacy, safety, avoiding unnecessary risk, come into play. And in healthcare, they should. So, I mean, what do you think? Like, what's the next big thing in health information technology?
I think there's a few things. I think about the common healthcare challenges at the moment, and I summarize to three areas.
Okay.
One, there's a workforce challenge. Clearly, the carers, clinicians, providers, they're overworked, they're burnt out, and we have a shortage right around the world. COVID just made it worse, unfortunately. The second one is around the healthcare system is hard to navigate for patients and consumers. You're constantly repeating yourselves when you talk to your providers, or you're trying to find the right service to engage with. And then when you think about the third one, which is around that siloed data or information that's all around the place, how do we tackle that? I think the future of that is actually bringing that together and actually having a unified platform that actually can help with that. And I think that's where Orion Health is quite proud to be able to serve all three of those challenges, but actually multiple more than that. And so where we want to take this to is with I think our data platform, the really cool thing is we can work with a large amount of data all around the world, which we've been doing for several years. But once we have that data, we want to be able to have value-add services. So it's not just about the AI, but what else could we do to actually work with organizations to help them solve some of the fundamentals? And then the second thing for me is actually back to that patient-centered care. So from a provider perspective, being able to have that access to that single health record, but from a patient perspective, how do we empower the patient to more proactively participate in their health and well-being? So I think when you bring those areas together, to me, that's the future.
Nirvana right there. Healthcare
Exactly.
nirvana
Easier said than
worldwide,
done.
I love it. I love it. That'd be great. Well, thank you so much for taking the time to chat with me today and for, talking through some of these different forces that are, shaping the healthcare technology market. It's not often I get to talk to somebody with your breadth of exposure to different types of health systems around the world. And so it's interesting to hear, your take on what everyone is talking about and, where these challenges are coming from. Because I mean, despite the fact that they're coming from different places and different health systems, the challenges are still the same. Like that's what's like the really remarkable part, but everybody's kind of coming at the solution in a different way. So thank you. I very much appreciate your perspective.
Yeah, thank you, Jessica. Thank you for having me.
All right. To find more interviews with the people who are changing the way that we do healthcare, you can head on over to my YouTube channel. It's youtube.com/WTF Health. I'm Jessica Damaso. That's Niru Rajakumar from Orion Health. Thanks again for joining us, everybody. We'll talk to you guys real soon. Bye.